Good day everyone. Today I will be reporting my topic about mental retardation checklist or mas kilala ngayon bilang intellectual disability. This report focuses on how the checklist helps teacher identify learners who may need further assessment and support. This checklist is used as a guide for teachers to identify possible signs of intellectual disability in learners, and it helps in noticing behavioral and learning difficulties early so that the proper support can be given. However, it is important to remember that this checklist is not a diagnostic tool but only a screening guide. According to IDEA, or Individual with Disability Act, mental retardation refers to significantly sub-average intellectual functioning that occurs together with deficit in adaptive behavior, starting during the developmental period and negatively affecting the child's school performance. Sa pinakasimpleng terms, ang meaning nito is yung child may difficulty siya sa learning, thinking, and daily life skills compared sa other children na nasa same age ng bata. Ano nga ba ginagamit yung checklist na to? Yung checklist is ginagamit siya in 4 simple steps. Ang unang step is yung teacher, pinipil niya muna yung student information and nire-rate niya yung bawat isa to na na-observe niyang behavior. And the second, yung result is ini-interpret niya. The more behavior na na-observe, the higher the possibility of intellectual disability, but this is not the final. Yung mga na-observe ng teacher, hindi pa yun final para maging base na masabi na yung bata is may problema siya sa intellectual niya. The third, if many red flags are present, the student may be referred for further professional assessment. And lastly, or yung pang-apat, the subcategories help identify a specific area where the students struggle, which will guide intervention planning. Ito yung example or itsura ng checklist na ginagamit para sa kanila. Ano nga ba yung intellectual disability? Ang intellectual disability is also known as learning difficulties or cognitive impairment. The student with this condition usually have a difficulty in basic academic tasks such as reading and math. They may also struggle with social skills, organization, and daily living activities. Now, let's move forward to diagnosis and level. Diagnosis is done through standardized IQ tests such as the WISC or Wechsler's Intelligence Scale for Children or Stanford Binet. A student is diagnosed with intellectual disability if their IQ is 70 or below, and they also show difficulties in adaptive behavior. There are 2 general levels, the mild to moderate, where the student can still function with support, and the second one is the severe to profound, where the intensive and lifelong support is often needed. Now let's move forward to the causes of ID or intellectual disability. There are different causes of intellectual disability. This can be genetic, such as the Fragile X or Down syndrome, prenatal factors including the exposure to toxins and poor nutrition during pregnancy, and postnatal causes. It includes naman the serious infection, head injuries, and lead to poisoning. And some students also experience ID or intellectual disability alongside autism or sensory difficulties. Some condition may look similar to intellectual disabilities. This includes language impairment, where the children struggle with communication but has normal intelligence, and autism, which may also coexist with ID or intellectual disability depending on the severity ng kanilang sakit or conditions. Ano nga ba yung mga condition na makapagsabi na may intellectual disability? Student with intellectual disability may also experience ADHD, behavioral issue, emotional problems, or immaturity. They are also at greater risk of abuse due to the vulnerability and limited problem solving. And now, sino nga ba yung mga professionals na involved dito? So, different professionals work together to support this student, including the teachers, psychologists, speech pathologists, occupational and physical therapy, pediatrician, child psychiatrists, and social workers. So, this collaboration ensure a holistic support for the learners. So, para naman sa action plan, to support this student with intellectual disability, it is important to conduct a proper assessment, create an individualized education program or IAP, simplify lesson, provide hands-out learning, and offer more practice time. So, and also, yung support from family and community is also essential for student development and inclusion. The mental retardation or ID checklist serves as valuable tool in identifying learners who may have intellectual disability. Although, it does not give a final diagnosis, katulad nga ng sinabi natin kanina, hindi siya pang-diagnose, kundi isa lang siyang screening tools. So, it helps teachers decide where further assessment and proper intervention are necessarily to support the learner's educational journey. So now, I will be discussing the other special needs that we encounter in the classroom. So, this includes the giftedness, immaturity, low self-esteem, child or adolescent abuse, and developmental coordination disorder or dyspraxia. So, the goal of this report is to help us identify their characteristic and know the appropriate action plan as a future SPED educators. So, ano nga ba yung giftedness? Giftedness refers to students who show exceptional ability in one or more areas, like academics, creativity, leadership, or sa arts pa man. So, these learners think at a higher level than their peers and often understand concept faster. So, ano nga ba yung characteristic ng gifted learners? So, gifted learners usually learn fast, have advanced vocabulary, and show strong curiosity. So, they ask a deep question and minsan, yung question nila is pang-adult na or parang mas challenge ka kasi mapapaisip ka kung ano nga ba yung sagot. So, they may also have a high imagination, creative ideas, and superior problem-solving skills. However, some gifted kids can be sensitive or perfectionist, which can affect their emotional well-being. So, for example, dito, gifted grade 3 students answer all math problems quickly. But, umiyak siya when she got only 9/10 instead of a perfect score. Kasi, ina-expect niya na ma-perfect niya yung gawain. So, yun, parang sa sobrang perfectionist niya, yung emotion niya, tawag dito, naapektuhan. So, ano nga ba yung challenges ng mga gifted student? So, even if they are advanced learner, gifted students face unique challenges. So, marami sa kanila ang naiinip sa regular lesson because they already mastered that content. And they may also feel isolated kasi they think different kasi naisip nila na they are different sa kanilang mga kaklase. And perfectionism is another big issue na kinakaharap ng mga gifted student kasi they set very high expectation sa sarili nila. So, ano nga ba yung mga action plans for gifted learners? So, to support gifted learners, we can give enrichment activities, advanced reading materials, or challenge tasks. So, it allows them to explore their interests like research, art, or leadership role, and at the same time, support their emotional needs by teaching them balance, resilience, and how to handle frustration. So, ito nga pala yung example ng checklist na ginagamit nila. next is the immaturity. So, ano nga ba yung immaturity? So, immaturity happens when a child's emotions or social behavior is behind what is expected for their age. So, hindi ibig sabihin na may disability sila, sometimes delayed lang ang kanilang development or kulang sa social exposure. So, ano-ano nga ba yung mga characteristic ng mga immature learners? So, immature learners may get frustrated easily, they have difficulty following routines, at madalas impulsive or overly dependent sila sa adults. So, they may also struggle with making friends or understanding social cues. So, ang example neto, a grade 2 student cries every time he loses in game and refuses to share materials with his classmate. And yon. So, ano nga ba yung mga causes ng immaturity? So, immaturity can come from different factors, developmental delay, overprotective parenting, lack of social experience, emotional insecurity, or unstable home environment. So, sometimes the child simply needs more time and experience to build independence. So, ito yung kailangan ng mga bata ng bonding kasi mas mas nagre-relate sila sa mga adults or sa mga parents nila. So, ano nga ba yung mga action plan for immaturity? So, to help immature learners, we can establish clear routines and give visual schedules, and also we can break tasks into small steps para mas manageable or one step at a time. And also, it includes the providing social skill training like turn taking, sharing, and handling emotions. And yung pinaka-important is magbigay tayo ng consistent positive reinforcement for even small success or kahit pa na maliit na success sa kanila or sa atin is kailangan natin silang bigyan ng positive reinforcement para mas yung ego. So, ito nga pala yung example ng checklist na ginagamit nila. So, next is the low self-esteem. So, ano nga ba yung low self-esteem? So, low self-esteem means the child feels insecure and doubts their own ability. Dito, yung mga child is, naiisip nila na hindi nila kayang gawin yung isang bagay kahit hindi pa nila nagagawa. So, ano naman yung characteristic of low self-esteem children? So, these students shows negative self-talk, avoid challenges, and are very sensitive to criticism. So, they may be quiet or nagwi-withdraw sila and sa pag-withdraw nila na yon, nadi-discourage sila. And other needs constant reassurance, which shows their lack of confidence. So, for example, a learner says, "Ma'am, mali na naman ako." Kahit hindi pa siya nag-a-answer ng question. Parang tinawag lang siya and ang sagot niya agad, "Ma'am, sorry, mali agad ako." Yun, nagda-doubt agad sila sa sarili nila. And ano nga ba yung mga causes nito? So, low self-esteem can come from harsh criticism, bullying, academic struggles, neglect, or unrealistic expectations from adults. So, students experiencing emotional abuse or rejections at home also commonly develop low self-esteem. So, ano nga ba yung mga action plan na pwede natin gawin sa mga children with low self-esteem? So, first, we should praise their efforts, not just the result. And ito, makaka-help to sa kanila para maka-gain ng confidence kasi sa small successful nila, alam nila na may naniniwala sa kanila or kaya nila, na may nagpapatunay na kaya nila. So, pangalawa naman is assign simple leadership tasks to build self-belief. And third is encourage peer support, avoid comparison, and help the children recognize their strength. So, dito, para naman mas makahelp tayo sa mga children na may low self-esteem is, hindi natin dapat sila i-compare sa peer nila or sa kaklase nila. And with that, mahelp pa natin sila na mahanap or ma-recognize kung saan ba sila magaling. kunwari magaling sila sa ganitong gawain, magaling sila sa ganito, and kasi I truly believe na ang bata is may iba't ibang kakayahan, or every child is unique. So, ito nga pala yung example ng checklist na ginagamit nila. So, child or adolescent abuse. Ano-ano nga ba yung mga types ng abuse? Children can experience four main types of abuse. First is the physical, second is the emotional, and third, the sexual, and fourth, neglect. So, abuse may occurs or nangyayari ito sa bahay, sa paaralan, or sa community. And ano-ano nga ba yung sign and characteristic nito? So, yung sign of abuse includes sudden mood change, withdrawal, fear, sadness, and depression. So, some of the student is tinatago nila yung mga pasa na natatamo nila, and nagigib sila ng maling information or maling sumbong kung saan nila nakuha yung pasa. And emotionally and sexually abused student may experience trauma in drawing or writing or showing inappropriate sexual behavior. So, for example dito, a child refused to join PE because she doesn't want classmate to see the bruise or yung pasa sa kanyang arms. Kasi nga, natatakot siya na baka natatakot siya magsabi na kung saan niya nakuha yung pasa na yon. So, bakit nga ba hindi nagre-report yung children or yung student? So, children often stay silent because they fear not being believed, or takot sila na hindi paniwalaan, being blamed, or sila yung sisihin kung bakit nangyari sa kanila yon. Or, ang mas malala pa is kapag nagsumbong sila, mas magpapunish sila or paparusahan pa sila ng kanilang parents. Also, they also worry that na baka yung parents nila is masangkot sa gulo. Kasi 'di ba, yun nga, kapag may ibang parents na masyadong mahal yung anak nila, kapag nalaman nila na nasaktan yung anak nila, papaglaban nila yon. So, yung mga learners is yung other student na nakakaranas ng ganon is natatakot sila na ma-involve yung parents nila sa gulo. And also, yung ibang almost pala sa mga student is they feel ashamed, and especially lalo na napi-feel ashamed sila kapag sexual abuse yung nararanasan nila. So, ano-ano nga ba yung mga related conditions na connected dito? So, abuse is strongly linked with depression. Students with ADHD are also at higher risk of abuse dahil sa impulsivity and challenging behavior nila. So, those with intellectual disability are more vulnerable to sexual abuse due to natively and poor social judgment. So, sino-sino naman yung mga professionals na involved dito? So, cases of abuse involves a child protection team. So, dito, yung mga professionals na involved dito is the teachers as mandatory reporters, social workers, psychologists and psychiatrists, legal advisors, and also sometimes yung mga parents or temporary caregivers, and pinaka-important is the collaboration. So, ano nga ba yung action plan para sa mga na-abuse na learners or students? So, as a teacher, we are legally required to report suspected abuse. So, we must follow our school procedure and keep detailed document. And also, we also need to provide a safe, predictable classroom environment and teach protective behaviors like recognizing unsafe situation or knowing trusted adults, work closely with social workers, and continue monitoring the child's emotional well-being. So, ito nga pala yung example ng checklist na ginagamit nila. Next is the DCD and dyspraxia. So, DCD or dyspraxia is a neurological condition na nakaka-affect sa monitor planning. Hindi lang ito yung paghina ng mga muscles. Itong mga student na to is known what they want to do, but their body has difficulty executing the movement smoothly. So, dito, ito yung alam nila yung dapat gawin, pero yung katawan nila is hindi magawa yung movement na yun kasi nga meron silang impairment. So, ano yung characteristic neto? So, they may appear clumsy, have difficulty in writing, drawing, or using scissors. Handwriting is usually messy or slow. And they may take longer to finish tasks and struggle with copying from the board. Some shows verbal dyspraxia, and meaning neto is their speech is unclear, or yung words na lumalabas sa bibig nila is mali. So, parang feeling ko dito na rin papasok yung pag-i-stutter ng bata. And ang example neto is a student tries to write neatly but the letters are uneven and the words go up to the margin despite maximum effort. So, kahit full effort na yung binibigay ng bata sa pagsusulat, tinatry niya pa rin tinatry pa rin niya na isulat ng malinis and even yung mga words, letter, pero hindi niya kaya kasi nga yun, may problem siya sa paggalaw. So, some learners with DCD or dyspraxia also have a sensory integration difficulties. So, they may be overly sensitive to noise or touch or seek sensory input by tapping, fidgeting, or touching object constantly. So, ito yung mga learners na sensitive sila sa noise. So, ito yung mga learners na hindi pwede sa concert kasi 'di ba, or kapag may event or malapit sila sa speaker. So, dapat itong mga learners na to is may mga sariling headphones or headset para malesen yung yung pagiging sensitive nila sa noise. And sino nga ba yung mga professionals na involved dito? So, intervention usually involves occupational therapies for fine motor skills, physical therapies for gross motor coordinations, and speech pathologies for verbal dyspraxia, and teachers who provide classroom accommodations. So, ano nga ba yung action plan para sa mga learners na may DCD or dyspraxia? So, these students need support, not pressure. Dito, kailangan nila ng i-avoid na sabihin sa kanila na dapat yung sulat mo maayos. Kasi, yung issue dito is neurological. So, yung action plan for them is provide proper seating and do not penalize them for messy work. Give printed notes or copy or reduce copying tasks. Syempre, dun sila nahihirapan eh. And allow extra time for writing or let them use a computer or script. And modify PE tasks to match their abilities and provide sensory tools like stress ball. And lastly is to encourage them to encourage movement activities through fun and not competitive tasks. So, yeah. Yun yung mga action plans na pwedeng gawin sa mga learners with DCD or dyspraxia. So, ito nga pala yung example ng checklist na ginagamit nila. So, to sum it up, in summary, learners with special needs or with other special needs, whether gifted, immature, struggling with self-esteem, experiencing abuse, or having motor coordination difficulties, nire-require sila ng individualized support kasi nga iba-iba sila ng needs. So, as SPED educators, we must observe carefully, offer intervention early, and collaborate with professionals to provide a safe and nurturing learners environment. So, that's all. Thank you for listening.